Laboratory safety is a critical part of any university's safety program because there is so much information, so many people involved, and so many details to be learned. Of course, the underlying importance is educating you in the various science disciplines and how to work safely with chemicals. Your university's laboratory safety program is comprised of the chemical hygiene program, biological safety program, and radiation safety program, and possibly other topics. In this program, we will cover what a basic chemical hygiene plan is and how you can use this information to stay safe and healthy in a learning environment. A chemical hygiene plan is a written program developed and implemented by your university. This plan sets out procedures, equipment, personal protective equipment, and work practices that are capable of protecting you. In this case, students, staff, and professors are to be protected from the health hazards presented by hazardous chemicals used in your educational facility. In this program, we will cover some of the components of a chemical hygiene plan. These components will include the basics of training, engineering controls, personal protective equipment, and chemical hazards in the university laboratory. All personnel working in laboratories or facilities where chemicals are used or stored must receive chemical safety training before starting work. This training must be renewed annually. Chemical safety training familiarizes you with common chemical hazards, your university's chemical hygiene program, and safe practices for acquisition, use, storage, and disposal of chemicals. In addition to general training, you must receive training specific to the laboratory in which you work. This training must include such topics as risks associated with the hazardous substances in the laboratory, physical hazards present in the laboratory, proper use of instruments and safety equipment, and laboratory procedures and protocols. Each individual laboratory, corresponding department, and the Environmental Health and Instructional Safety Department retain documentation of such training. Laboratory safety training in instructional laboratories will be provided by your professor or course instructor. This training will include a discussion of the risks associated with substances used and procedures to be performed, proper techniques for handling and disposing of hazardous substances, safety precautions to be used to prevent exposure or release into the environment, and emergency and spill procedures. Professors, principal investigators, must prepare standard operating procedures, SOPs, for every experimental procedure that involves hazardous agents. The SOP shall define the hazardous operations, designate safe practices, and select protective equipment. Your professor, principal investigator, shall then make sure that laboratory workers receive instructions and training in the SOP to ensure safe work practices in the laboratory. Engineering controls are controls that eliminate or reduce exposure to laboratory hazards through the use or substitution of engineered machinery or equipment. Examples may include self-capping syringe needles, ventilation systems such as a chemical fume hood, sound dampening materials to reduce noise levels, safety interlocks in analytical instruments, and radiation shielding. The three types of engineering controls are substitution, ventilation, and isolation. Chemical substitution means replacing one chemical with another less hazardous one. This is done to reduce the safety and health risks of a procedure. The purpose of equipment substitution is to reduce the danger of equipment use. Ventilation controls are designed to prevent employee exposure to airborne contaminants. The use of exhaust air treatments from isolation rooms is an example of a ventilation control. Isolation controls are used when ventilation systems cannot keep hazardous chemicals from the general atmosphere. Fume hoods, glove boxes, and ventilation storage cabinets are all examples of isolation controls. Passageways and aisles must be a minimum of 36 inches wide and must remain unobstructed. The location of emergency exits for each laboratory and laboratory support room must be clearly marked. Exits, stairs, and passageways should be permanently illuminated to facilitate evacuation in the event of an emergency. Emergency exits must be clearly marked. Fire doors must remain unobstructed. The manufacturer's original container labels should be left on the containers and kept intact. When transferring a chemical from the original container into a secondary container, the secondary container must be labeled with full name of chemical product, if applicable, full name of chemical constituents, no abbreviations, acronyms, or chemical formulas, chemical, physical hazard warnings. If an empty bottle is going to be reused, be sure the new contents are compatible with the original contents of the bottle. You must then remove or completely deface the old label so there is no confusion over the contents in the container. Gloves can protect your hands from a variety of hazardous substances. They are great tools, but they work best when they are used properly. The saying, "the right tool for the right job," is the same for gloves. The right glove for the right job. There are many types of gloves, but probably the most used and possibly misused is the natural rubber latex NRL glove. They are readily available and relatively cheap. They are good for work with biological hazards and aqueous solutions, but are not useful when working with strong, concentrated acids and bases or organic solvents. If you use the NRL gloves, for more specific information, see the following website for the Ansel gloves used on campus: www.anselpro.com/specware/index.asp. Although NRL gloves have become the material of choice for hand protection in many universities, some people have reported certain irritations and/or adverse reactions associated with the use of these gloves. These adverse reactions typically manifest themselves in the form of irritation, delayed hypersensitivity, or immediate hypersensitivity. What should be done if you have experienced symptoms associated with an irritation? First, you should consult with your professor or EHIS office. Consider using powder-free gloves, which may help reduce your irritation. Neoprene gloves have been shown to cause less irritation. Neoprene is resistant to most organic and inorganic acids, bases, solvents, oils, and alcohols. This may be a workable alternative. You should know your glove type. Is it appropriate for the job? Gloves should be changed often. Remember to remove your gloves before leaving the laboratory to prevent contaminating other things. Always wash your hands after using gloves. Double gloving is helpful when you change gloves a lot. Remember, before using any glove, read the Material Safety Data Sheet, or MSDS, for the materials that you will be working with, and, when in doubt, check with the glove manufacturer for specific use. All containers utilized for collecting used hazardous material must meet the following criteria: undamaged and in good condition with no leaks or cracks, kept closed when not actively adding waste to the container, properly segregated from incompatible materials, always stored within secondary containment, trays, vessels, affixed with a chemical content label used for listing chemicals. When disposal or removal of hazardous chemicals is required, call Environmental Health and Instructional Safety to arrange a pickup. Be sure to carefully label all chemical containers with chemical contents, no abbreviations, acronyms, chemical formulas, and chemical, physical hazard warnings. Benchtops must be capable of supporting the weight of equipment and should be resistant to chipping or damage from routine laboratory operations. Desks and shelves should never be used as a substitute for properly designed benchtops. All laboratories are required to have a fully functional sink with a drain and pressurized water. No chemicals should be dumped or disposed of in the sink. Lunchrooms, break rooms, and restrooms must be separate from laboratory areas. You should remove all personal protective equipment before exiting the laboratory and should wash your hands before entering other areas. If you are working in laboratories or laboratory support rooms, you must have access to a telephone that can be used to dial 911 during or after routine work hours. Emergency contact information should be available near the laboratory exit. Each laboratory should contain or have easy access to safety equipment, including emergency showers and eye wash stations, first aid supplies, spill supplies, fire suppression equipment, and chemical fume hoods. Additional safety equipment may be required depending on the substances used and procedures performed. An emergency shower and eye wash station must be available within a 10-second walk from each area where hazardous substances are used. Further, the emergency shower must be clearly labeled and easily accessible. In the event of chemical exposure to skin, you should immediately flush exposed skin with cold water for a minimum of 15 minutes, making sure to remove any jewelry or clothing that has become contaminated. If the exposure occurs to the body, then you must use the emergency shower for a minimum of 15 minutes. If chemicals get into the eyes, immediately flush eyes with emergency eye wash for a minimum of 15 minutes. The eyelids must be held open to wash, and the eyes rotated to ensure proper rinse of eyes. In all of these situations, you should immediately seek medical attention and contact 911. Be sure to carefully explain what chemicals were involved. If possible, take an MSDS with you. A fire extinguisher must be available near the laboratory exit or in the hallway and within 75 feet of the laboratory. It is generally recommended that laboratories be equipped with ABC-type fire extinguishers. More training on fire prevention and fire extinguishers will be presented in other training programs. All laboratories and laboratory support rooms should be equipped with first aid supplies to assist you in responding to minor injuries and spill supplies relevant to the activities of the laboratory. These supplies should be clearly marked, easily accessible, and located near the laboratory exit. You must know the location of these supplies. Remember, you may clean up a small spill only if you have been properly trained by environmental health and instructional safety and are familiar with the material and its hazards. For large spills or leaks, make sure to notify University Police by dialing 911. Always use personal protective equipment, including gloves and eye protection, when handling hazardous materials. A well-designed fume hood, when properly installed and maintained, offers a substantial degree of protection to the student and professor, provided that it is used correctly and its limitations are understood. Fume hood sashes should always be maintained in the closed position when not in use. The amount of energy used by one fume hood is equivalent to the energy used by 3 average households. Each chemical hood is labeled to indicate the best sash position. The exception is the variable volume exhaust hood. These hoods maintain 100 feet per minute at any position at or below the sash stop. All apparatus and equipment should be located at least 6 inches away from the hood face. This distance should be indicated on each chemical hood with black and yellow tape. You should always keep your head outside of the chemical hood. The only exception is when you are installing or dismantling equipment. Before beginning work, you should verify that the type of chemical hood to be used and the face velocity are appropriate for the chemicals involved and for the procedure you are performing. Perchloric acid should never be used in a conventional chemical hood. Perchloric acid vapors accumulate in ductwork and form perchlorate crystals that have the potential to explode. This can cause serious injury to personnel and damage to property. For more detailed safety information, view the chemical safety program that describes the proper use of chemical fume hoods. Our next topic is personal protective equipment. You may see this written as PPE in safety documents. PPE must be provided to and worn by all laboratory personnel, students, and visitors when entering or working in a laboratory. At a minimum, a lab coat, gloves, eye protection, and closed-toed shoes are required. In early laboratories, few items of personal protective equipment were available for use. Early movies show scientists and forensic chemists standing around Bunsen burners on office desks. Chemicals would be at a rolling boil in beakers sitting on a ring stand open to the room. Men are portrayed wearing street clothes, ladies wearing open-toed sandals with high heels. Quite often, both men and ladies were working in hazardous environments without wearing safety glasses or other PPE. This is not acceptable in today's working environment. Personal attire must be considered when working in any laboratory. Clothing, accessories, and hair may be entangled in equipment, caught in an accidental spill of a hazardous substance, or pass through flames unintentionally. Proper personal attire includes clothing that provides adequate coverage for the legs. Footwear should be closed-toed. Any footwear worn in the laboratory should provide adequate support and suitable traction for laboratory activities. Hair should be confined or tied back. Loose sleeves, dangling jewelry, clothing that leaves the legs exposed, or shoes with heels greater than 1 inch should never be worn in the laboratory. In some instances, additional protection may be necessary. Material safety data sheets, commonly referred to as the MSDS, will provide specific PPE recommendations for handling chemicals. Personal protective equipment should be durable, designed to provide adequate protection, and capable of preventing exposure to hazardous substances. Personal protective equipment must be removed before leaving the laboratory, unless it is being used to safely transport substances between rooms and buildings. Even though personal protective equipment is an important component of a comprehensive laboratory safety program, it is not a replacement for good laboratory practices, engineering controls, and safety equipment. Eye protection must be worn when working with substances or equipment that present a hazard to the eyes. Safety glasses, goggles, should fit securely and be free of smudges or scratches that may obstruct vision. Safety glasses equipped with side shields provide more complete protection. In addition, safety goggles provide an increased level of protection. Safety goggles should be worn when chemical splashes could occur or when glassware is being used under pressure. Contact lenses should never be worn when working in the laboratory because chemical vapors can permeate the lenses and become trapped on the surface of the eye. For individuals who wear contact lenses or glasses, safety goggles are recommended instead of safety glasses because of the additional protection goggles provide. Face shields are designed to be used in combination with safety goggles to provide additional protection to the face and eyes against splashes and particulate matter. Face shields alone do not provide adequate protection against large projectiles or liquids unless they are used in combination with safety goggles. Safety gloves should always be worn when working with chemicals. Gloves should be comfortable, of sufficient length to prevent exposure of the hand and wrist, and should be appropriate for the type of work to be performed. Gloves should be inspected for visible tears before use, changed when they become soiled or compromised, and discarded appropriately after use. Lab coats should cover the entire upper body, extend to the knees, and fit comfortably without hanging too loosely from the arms. Lab aprons are designed to be worn in combination with a lab coat to provide extra protection when pouring corrosive chemicals, using an acid bath, or manipulating chemicals in a manner that increases the likelihood for splashes or spills. Lab aprons should fit comfortably and extend from just below the neck to just above the tops of the feet. Respiratory protection requirements vary depending on the type of respiratory hazard present. In general, respiratory protection should fit snugly and form a seal so that air may not leak through the sides of the respirator. Types of respiratory protection may include the use of half-face mask, full face mask, powdered air purifying respirator, or a particulate mask. Our last topic is chemical hazards in the university laboratory. The hazardous nature of a chemical is determined by the potential for the chemical to cause adverse health effects or toxicity and the physical hazards inherent to the properties of the chemical, for example, a chemical's flammability or reactivity. Corrosives such as acids and bases. Corrosive materials are materials that can corrode the skin or metal. Examples are hydrochloric acid and sodium hydroxide. Flammables and combustibles. These materials can readily ignite and burn vigorously. Examples include acetone, ethers, and alcohols. Toxics such as mutagens, poisons, carcinogens. These materials may contain a known mutagen or known carcinogen, exhibit oral toxicity, contain toxic metals or pesticides, or are toxic to marine life. Examples include mercury, formaldehyde, ethidium bromide, acrylamide, and ethyl acetate. Oxidizers and organic peroxides. These materials release oxygen readily to stimulate the combustion of organic matter. Examples are potassium permanganate, concentrated nitric acid, bleach, concentrated hydrogen peroxide, and urea hydrogen peroxide. Air and water reactives and pyrophorics. These materials react violently with air or water. Examples include sodium metal, magnesium metal, and zinc dust. The toxicity of a chemical is the ability of that chemical to cause a reproducible dose-dependent effect on a biological system. The conditions of exposure and the susceptibility of the exposed individual influence the types of toxic effects that occur. The physical and chemical properties of a chemical, route of entry, dose, and the frequency and duration of exposure are important factors to consider when assessing chemical exposure. The physical and chemical properties of a chemical affect how it is absorbed by the body and the rate of absorption. A common way for chemicals to enter the body is through direct contact with the skin or eyes. Skin contact with a chemical may result in a local reaction, such as a burn or rash. Inhalation is the most common route of entry for chemical vapors, particulates, and aerosols. The term aerosol refers to liquid and solid particles suspended in a gaseous medium. Aerosols can be produced by centrifugation, homogenization, such as the use of a blender, sonicator, grinder, or mortar and pestle, mixing, vortexing, or stirring, use of a separatory funnel, and pipetting. Ingestion is another possible route of entry. Although direct ingestion of a laboratory chemical is unlikely, an individual may ingest contaminated food or beverages, touch the mouth with contaminated fingers, or swallow inhaled particles which have been cleared from the respiratory system. Direct ingestion may occur as a result of the outdated and dangerous practice of pipetting by mouth. The technique of mouth pipetting should never be used. The risk of ingesting hazardous chemicals may be reduced by not eating, drinking, smoking, applying cosmetics, or storing food in the laboratory. You should always wash your hands thoroughly after working with chemicals, even when you have been wearing gloves. Percutaneous exposure may result from a needle stick, puncture with a contaminated sharp object, or through wounds or abrasions. An acute exposure is characterized by a single exposure to a relatively high dose of a hazardous chemical with a short duration of exposure. Immediate or delayed effects of acute exposure are more severe, but may be reversible if exposure ceases. Individual susceptibilities play a significant role in the effects observed as a result of exposure to hazardous chemicals. Most chemicals have an odor that is perceptible at a certain concentration, referred to as the odor threshold. However, there is considerable individual variability in the perception of odor. You should be familiar with the health hazards associated with the toxic chemicals you use. Some signs of chemical exposure may include headaches, difficulty breathing or shortness of breath, increased mucus production, irritation or watering of the eyes, irritation of the nose or throat, confusion, dizziness, drowsiness or loss of consciousness, an unfamiliar chemical odor, irritation, rash, or discoloration of the skin, unusual muscle cramps or joint pain, or nausea. If any of these symptoms occur, you should notify your instructor or professor, immediately evacuate the laboratory, and discontinue work until proper arrangements are made to prevent exposure. Irritation to toxic substances may occur as a result of dermal, ocular, or inhalation exposure. Some common examples of irritants include ammonia, hydrochloric acid, halogens, sulfur dioxide, acetic acid, and formaldehyde. Chronic toxicity is characterized by adverse health effects as a result of repeated exposure to a low dose, typically below concentrations where acute effects are observed over a long period of time. Carcinogens, reproductive toxins, and some solvents are examples of hazardous chemical substances that can cause chronic health effects. Asphyxiation is oxygen deprivation due to oxygen displacement in the environment. Asphyxiation can also be caused by chemical effects on the body. For example, hydrogen cyanide binds with hemoglobin to prevent oxygen transfer in the lungs, which can cause asphyxiation. Simple asphyxiants are inert gases which displace oxygen in the environment. Examples of simple asphyxiants include nitrogen, carbon dioxide, and helium. Sensitization is an immune response to hazardous substances in susceptible individuals. It is possible to be allergic to a variety of substances and chemicals. The MSDS indicates whether a chemical is known to be a sensitizer. Hazardous chemicals include explosive chemicals, compressed gas cylinders, flammable chemicals, reactive chemicals, oxidizing chemicals, organic peroxides, corrosive chemicals, cryogenic liquids, and dry ice. An acute exposure to very high concentrations of organic solvents can cause unconsciousness and death. Chronic exposure can cause nausea, headaches, fatigue, and mental impairment. Injury to the organs of the body and damage to the blood may also occur. In this program, we have covered major components of a chemical hygiene plan specifically for universities. These components included the basics of training, engineering controls, personal protective equipment, and chemical hazards in the university laboratory. We hope that you can use this to stay safe and healthy in your learning environment. If you have any questions, contact your safety department.